Ever wondered why an athlete might risk their career to use diuretics? Well, today we're going to explore that very question. Diuretics, a group of drugs commonly associated with medical treatments, have found a peculiar place in sports. They've become the hidden ace up some athletes' sleeves, a controversial tool for enhancing performance. But why? What makes them so attractive yet so risky? Stay with us as we dive deeper into the world of diuretics and sports performance. To understand the athlete's interest in diuretics, we must first comprehend how they function. Diuretics are a class of drugs that prompt the kidneys to increase the production of urine. This process is like turning up the volume on your body's natural waste disposal system. The kidneys, which act as our body's filter, start working overtime to remove excess fluids and salts from our blood. This filtering process involves the nephrons, the tiny functional units of the kidneys. They reabsorb vital substances back into the bloodstream and expel the rest as urine. But when diuretics enter the scene, they interfere with this reabsorption process. They prevent the nephrons from retaining water and salts, leading to a higher volume of urine. This increased urine output essentially flushes out excess fluids and salts from the body. With this knowledge, we can start to see why these drugs might be attractive to athletes. Armed with the knowledge of how diuretics work, it's time to explore their role in sports. When it comes to weight class sports like wrestling or boxing, athletes may resort to diuretics for rapid weight loss. This allows them to qualify for a lower weight category, potentially gaining an advantage over smaller opponents. But the use of diuretics doesn't stop there. Some athletes may use them as a masking agent. By increasing urine production, diuretics can dilute the presence of other banned substances in urine samples, making them harder to detect during drug testing. Then there's the contentious belief that dehydration, induced by diuretics, might enhance performance. The theory suggests that a lighter body could lead to increased speed or agility. However, it's important to note that this can have serious health implications, including severe dehydration and electrolyte imbalances. While the short-term gains might seem appealing, the long-term risks and ethical considerations make the use of diuretics a contentious issue in the world of sports. We've ventured into the intricate world of diuretics and their controversial usage in sports performance. We've dissected the mechanics of how these substances work, delved into reasons athletes might resort to their use, and explored the risks and ethical dilemmas they present. This knowledge paints a more nuanced picture of the headlines we often encounter. Next time you hear about diuretics in sports, you'll be well equipped to understand the complexities behind the headline.